Let's walk through the findings on this pelvic radiograph together. We have an image of a skeletally mature male. The first thing that catches the eye is a very well-defined area of dense calcification projected over the left ilium. This calcification measures at least 5 centimeters in diameter, which is quite significant. Next, if we look towards the flanks, we see clusters of predominantly curvilinear calcifications situated above the iliac crests on both sides. These calcifications are not fully visualized in this particular image, so we can't see their entire extent, but their appearance is notable. Also, it's important to mention the extensive vascular calcification visible throughout the image. This isn't just an incidental finding. Florid vascular calcification of this degree suggests an underlying chronic condition, most likely something like chronic renal failure, especially given the presence of the other calcifications in the flanks. Now, putting all these findings together, the calcifications in the flanks above the iliac crests are highly suggestive of enlarged polycystic kidneys. Given the distribution and appearance of these calcifications, we are likely dealing with a case of renal transplant autonephrectomy. The specific morphology and location of the dense calcification in the left iliac fossa further support this conclusion. At this point, it's essential to correlate these findings with the patient's clinical history. If the patient has a history of polycystic kidney disease or chronic renal disease, that would reinforce our interpretation. Additionally, I would recommend reviewing any previous imaging studies if available to track any changes over time and to confirm whether these calcifications were present previously or if they are new findings. Overall, this case illustrates how critical it is to consider the clinical context and previous imaging when interpreting complex cases like this, particularly in patients with a history of renal disease or transplantation. The dense calcifications we see here are more than just incidental findings. They provide vital clues about the patient's underlying condition and the history of their disease.